The best claim is one that never gets filed. The best one is when nobody gets injured in the first place. The second best claim is getting it paid and appropriate medical treatment and having that person get back to their pre-injury status and they're healed.
You're listening to Beyond the Claim, the show for forward-thinking risk and claims professionals curious about the latest industry trends, winning strategies, and stories from influential leaders. Let's dive in.
Hello, and welcome to this episode of Beyond the Claim with your host, Mark Cunningham, Chief Sales and Marketing Officer with Broadspire. Today I have with me Theresa Clarke. Theresa is a Manager of Workers' Compensation at Advocate Health Aurora. Theresa, welcome.
Thanks so much for having me. I appreciate it.
Thank you. Thank you for sharing your time with us. Looking forward to the conversation. So for folks that don't know, Theresa, what does Advocate Aurora Health do, and what do you do at Advocate Aurora?
Sure. Advocate Aurora Health is a group of hospitals and medical facilities throughout Wisconsin and Illinois. We support about 77,000 employees throughout the two different jurisdictions. So my main role is management and mitigation of work comp claims throughout the organization.
Excellent. So I'm curious. I ask folks, for their backstory as they we get into our conversation, and in looking through your profile and bios, I saw a path that I think I see sometimes, but I don't know that many really leverage and take advantage of. And I think it's impressive to see the journey that folks have within the risk space. I think your first job within the risk space was in the adjuster capacity. Is that right?
Correct. Yeah, I graduated from UW-Whitewater in 2003, I think. And my first job out of college was at a Wisconsin insurance carrier, kind of adjusting claims throughout several different jurisdictions. And then after that time in the adjuster realm, I got my property and casualty, health, life, and accident producer license and kind of sold some TPA services. So I went over to the agency side. Following that, I worked on the employer side for a national retail clothing company, kind of managing their workers' comp program, and it's at times 26 different jurisdictions. And my most recent previous role was the director of work comp at a self-insured group captive in Illinois and Indiana. So this manager role at Advocate Aurora is kind of a perfect serendipitous resolution for 18 years of experience adjusting and on the agency side and with TPAs. That's
fantastic. I know we're going through or approaching our silver tsunami apparently, and I think there's a need for many to understand that there's a pathway, a journey for many of us within this risk space, and it can take on different forms and there are different facets to it. So I love hearing that story. It does. Before I ask you more about what you're doing today, though, I do have to ask, because part of the reason that we're kind of in a void of talent to a degree, we're approaching that, right, if we don't manage this the right way, is because many don't see that journey from when I was in elementary school to go into risk management, right? It's not one of those, hey, I want to be a risk manager instead of a quarterback or a scientist. So what did you anticipate yourself doing, and then how did you go as you left school into the risk management space?
Sure, great question. I don't think any little kid, wakes up thinking they're going to be an insurance adjuster. That's going to be what their career path is. But it's often not presented even in college as kind of an opportunity. So I took a little bit different route. We started in the claims department, or I started in the claims department, and in college that's not presented as an opportunity. Most of the opportunities you hear about in insurance are either on the underwriting side or things like that, or sales. But claims it's a very steady, it's a consistent job. It's always going to be there. You can make good money if you are doing your job correctly and you like the work. So when I was a kid, I thought I was going to be a lawyer. So this kind of pairs very closely. I like the investigation. I like really digging in and getting my hands dirty and learning about each claim is so different. So being able to learn the intricacies of what and why and how to help. That's really what I've had a love affair with. I love it.
Very nice. Yeah, I think for those that can, and I see this, I spent some time in the benefit space as well, if you can appreciate the journey not necessarily being mapped out ahead of time, I think you can really, especially if you have a personality that thrives in that space, excuse me, I think you can really, accomplish some things that, that you may not have anticipated or even aspired to, otherwise. So that's great.
Yeah.
So Advocate Aurora Health System, we're in the, I was going to say that we're at the tail end, middle. I don't know where we are with this pandemic, so I'll put that out there. But I do know this has been going on for at least 20 months now. What's been the impact to your organization, to your employees? What's been the impact from a workers' compensation standpoint? How is this? How have things fared from the health system perspective?
Sure. How long do we have? It's been massive. It really has. Not only from a work comp standpoint, but supporting those frontline workers is so imperative, because if they're not healthy and being able to take care of the sick patients, we have nothing left. So our support, I think, on the work comp end and the team member health and safety end is invaluable. We really need to understand that our supporting role is only helping the frontline workers who are doing that really hard job day in and day out. Our claims volume has probably tripled in the past 20 months or so. And my incredible team has been able to stay within their space. We haven't had any increase in our number of employees. We've been able to keep the same number of employees within the departments, and they've just handled it. They're incredibly resilient. My team is fantastic. So I've gotten very lucky that there's a group of very responsible, productive individuals that work in workers' comp for me, and that's kind of helped us build and be able to keep our heads above water, because this has been a really, really tough year.
Yeah, that's amazing, that stat about just keeping that core team and the core group in place throughout this. That's not common these days.
No.
At all. So kudos to...
And I tell you, I could have used a couple others, but yeah, it happens.
No, kudos on that achievement, definitely. Yeah. Have you, from an organizational perspective, has there been any struggle with classifying, the classification of these COVID-related claims specifically to your employees, and maybe even some of the the long-term symptoms or comorbidities that have occurred? Which approach have you all taken? Have you taken this is somewhat fluid, we're going to assume there's a relation, a correlation, and move forward as a work comp claim, or has it been more of, it's not all, unless it's clearly defined, it's work-related or not work-related? Do you see yourselves going in any particular direction?
Yes. Advocate has taken a very measured approach into which claims are being accepted and which are not. Being a healthcare provider, I think the legislature in both Wisconsin and Illinois have kind of given us guidelines about frontline workers. In Wisconsin, if you can trace it back to one patient or one coworker that had COVID, that you can point to that person and say, that's likely where I got it, that's an accepted work comp claim. In Illinois, if you have excuse me, if you're working with a group of people that you think that was the exposure, it's likely going to be accepted. So due to the legislature and having kind of the presumption of contagion, it's made the accepting and determining the cause of these COVID exposures a little bit easier than, I would say, the general public.
So, follow-up question to that. I mean, I know, there's another variant out. We don't have a solid, or with confidence can't say what tomorrow, the next month holds. But at least for what you're planning for, how do you see your organization, you individually, continuing to plan for, prepare for, potentially react to this current norm, this new norm?
Sure. Absolutely. I think the vaccine is really, and we've mandated the vaccine. Our deadline is coming up October 15th. So every one of our employees, whether you stay at home, whether you're a frontline employee or office employee, will have to get a COVID vaccine. And I think that is going to take big steps into reducing the number of COVID exposures. The Delta variant is really has been devastating. Those are the sickest that I've seen these claims come through, the sickest people, the youngest people. So it truly is devastating to see how it's impacting our team members and how it's impacting their lives, their families, their spouses. So I think the vaccine really is going to move us into a direction that we're going to be able to manage and mitigate those. The numbers have gone down. So thankfully, we're not seeing as many catastrophic injuries, the hypoxic brain injuries or the paraplegia due to these strokes and things like that. Happened very early on in the pandemic. And while they're still some of them are still coming through, the numbers have dropped.
That's good. It's positive silver lining for sure. It's good to hear.
Yeah.
So speaking of positive, I'll pivot a bit and see, so I have to imagine that you've had some wins as well over the course of, the past year or so. Anything that stands out to you that says, we did that well, proud of that, or that you're preparing for and you see the horizon and it looks good? Anything you'd call out?
Yes, absolutely. My team has had so many. We have a lot of time, or we have some time, so hopefully I can go through some of them. Sure. But we've been able to do so much really during this exceptionally difficult time, and the resilience, dedication of my team has really driven that success. We're in the middle of a global pandemic affecting the frontline workers, so we're bombed all the time, and we're also harmonizing two programs. The Advocate Illinois side and the Wisconsin Aurora side, when they merged, I want to say it was in 2016, but don't hold me to that. The two programs had to decide, here's our philosophy over here, here's our philosophy. How are they going to mesh? So that's been an ongoing issue for a couple years. It's taken a lot of really hard work. Also in the middle of this, we changed brokers and carriers. And I'm the project manager for building out a new risk management insurance platform. So we are doing everything all at once. And my wonderful team has been really patient with me. Change is sometimes pretty difficult. It's scary. And when a lot of the areas of that job are changing kind of all at the same time, it can create some uncertainty. But luckily our team has faith kind of in the big picture and trust in our management and leadership on why the changes need to occur. So our department really has been fostering close relationships with team member health and safety, with legal, with our employee health and OC health teams. So with so many balls in the air, I'm just really, really proud of my team for being able to excel at not only their roles, but also coordinating with other departments and being open to change. So my motto has always been that our department is kind of responsible for taking care of the sick or injured team members so they can get back to caring for our patients. And the team has really taken that and run with it.
So what I'm hearing is managing through the pandemic alone wasn't enough. You've taken on anything that
was to stay busy.
Any stone that was not unturned or turned, you did that. Okay.
What's it over?
Kudos to you. That's impressive. I think, kidding aside, I mean, doing that, given the change in environment that I'm sure you all have gone through as well with, I'm sure many people, you have more frontline workers, so maybe remote is not as free, hasn't been as consistent for you over the past 20 months, but regardless, managing through that environment and then also taking on what sounds like more new projects, as well as closing out some that were already in flight. That's pretty significant in this current state of affairs where we find ourselves on more so than ever before. The natural breaks of old, whether it be commutes or travel or what have you, those are gone. Your constant meetings, constant go time, that's a lot to take on in that period of time. That's impressive. Congratulations.
Thank you.
So if you are looking at the industry at a maybe more macro level and you say, I have 18 years experience, I've seen and done a little of everything, we're taking on new challenges now. Have there been things along the way that you've said, I don't think individuals outside of this space really get it. There's some misunderstandings or misconceptions about either what we do, how we get it done, or how we can improve it. Anything like that stick out to you?
Yeah, absolutely. There's, some misconception about the insurance industry. Insurance isn't always boring. Insurance involves so many different facets and partnerships with lawyers, doctors, judges, and employees from really all walks of life. So every claim is different. One day you may be handling a case of a traveling employee who's involved in like an auto accident. And then the next claim could be a retail loss prevention officer who was bit by a snake that was hiding in a shoplifter's purse. So you never know what the day is going to give you. And those claims, like if you talk with insurance professionals, they have some incredible stories. Every single person that I've met in the industry has a crazy story like that. So it's really interesting. If you ever seen the movie The Incredibles, I have a 5-year-old, so Mr. Incredible, his day job or his cover job was an insurance handler. And I think the preconception of insurance work as kind of a boring, stodgy, bland job isn't really accurate these days.
Yeah, I totally agree with that. So now I did the snakes question, the snake story, excuse me. Was that intentional or was that just by chance?
Well, I think we decided that the shoplifter had the snake in the purse, and then when the loss prevention person went to go find the item that they thought they'd shoplifted, boom, there's a snake there, and it may have been I don't know. We accepted the claim, though. That's all I can tell you.
They just came from the exotic pet store, right? So,
right. And probably shoplifted that.
Great point. Oh, you're right, though. The stories that are out there, and even I'd say the pathway to the injury, I mean, which is part of the story, it's incredible, and then you hear what some individuals go through and that are adamant about their recovery, too. You hear those recovery stories that are just, when you have people that go through amputations and permanent disabilities of sorts, partial at least, and they're able to recover to a point where they are productive, citizens, in some cases more than they were before. It's empowering. So to your point on, it's often, the industry is often seen in a certain light. I think that there's so much reward that can come out of it in various roles and positions. So yeah, I agree that if anyone is interested in learning more, they really should, or sees it as a potential pathway, they really should, investigate further, because there's a lot to be gained from it for sure. Mm-hmm. So is there anything out there that you see as, hey, I need to fix this? Like, we need to fix this. This is, it's been this way, or it's at risk of going this way, and this is something that I would love to get my hands around it and really change if I could.
God, a wish list. I certainly have plenty. I think I'll go with one technical thing that we have been struggling with. I think on a technical legal end of things, I believe there should be a cap on a person as a whole benefits at 100% total, not per injury. So these frequent flyers, people who have multiple claims, can actually stack these permanent disability ratings and end up earning more than 100% of their entire body for a disability. It doesn't make much sense on a logical sense. So it also incentivizes them to kind of continue filing claims. So I will keep it at that.
No, I mean, so some of our audience is brand new to this space. So what you just described is something they've never heard before. So expand on that a little bit for me, so that you're saying that they could take advantage of a point within a claim that would exceed financially the return of where they were pre-disability.
Sure. So a permanent disability is rated based on the body part that was injured, and this is both in Wisconsin and Illinois. Man as a whole or person as a whole disability is usually capped at about 500 weeks, and that's just the benefits that you would be paid out if you are completely disabled due to the work injury. So each body part, it sounds a little weird, but each body part, including little finger down to your toes, has a rating with the state, and that's all state mandated. If you have a disability that gives you a certain percentage, the doctor at the end of your healing will say, you had this back surgery, I think you have a 20% permanent disability due to this injury. Here's your rating, and the insurance company pays out a certain amount of money based on your wages. You can stack that to more than 100%, which to me that doesn't make sense. If if a body as a whole is rated at 500 weeks, you shouldn't be able to get 600 or 700 weeks of disability for several concurrent back injuries. But, it's an opportunity, I think, for improvement. The state doesn't always get it right. Neither state gets it right. Nobody gets it right all the time. So just an opportunity, I think, for being able to cap it and put a little bit more pressure on the frequent flyers or the people who are career workers' comp filers.
Mm-hmm. Yep. Yeah. We do know those exist out there, unfortunately. There are many people that are appropriately filing claims, have legitimate situations and injuries, and then I think just as in life in general, you have individuals that are going to take advantage of the system. So, no, that's good to know. It's definitely good to know. So, as we look forward, as you look forward, months, year or years down the road, is there anything that you see that we don't have today that would help you do your job better, or that would improve the process for your employees as they're going through a claim? Or if you just had a magic wand and you said, hey, if we could do this, if we could bring this from my personal environment to this claim environment, it would transform the industry. Is there anything like that out there that comes to mind?
Yeah, our company has been fantastic about kind of looking towards the future and what we can do to keep our employees safe and prevent injuries. We're currently building out a team member health and safety roles and responsibilities, kind of a whole new department that is going to be more of the proactive, let's prevent these injuries before they happen. Where comp is kind of a reactive, an injury occurs and then we step in. So the team member health and safety program is designed to kind of look at those root cause analysis, figure out why that happened, figure out if there's a hazard that is evident in more than one location, and let's go in and fix it. So the best claim is one that never gets filed. The best one is when nobody gets injured in the first place. The second best claim is getting it paid and appropriate medical treatment and having that person get back to their pre-injury status and they're healed. That's the very best solution. I think there used to be, an old urban legend that the claims adjusters would get a kickback or something for every denial that they could crank out, and that's not true. So it's super important to realize that ultimately the company wants the best for you, in 99% of the cases. So we really are looking towards the future and trying to prevent those injuries that can be catastrophic. We don't want them to happen in the first place. So it's very exciting. Our director of team member health and safety and workers' compensation and our manager have been fantastic, and we're really excited to build that program out.
Excellent. Yeah, that's. I think we see more organizations, from my perspective, looking at ways that they can build out, advocacy or preventative programs that may not exist today to really get ahead of that, what's typically been a reactive environment. So that's great to hear. Excellent. Well, thank you. It's been a fantastic conversation, Theresa. I'm sure there are going to be folks out there that may want to get a hold of you and either ask you a question or invite you to a speaking engagement. In fact, I know you have a speaking engagement coming up around the evolving workforce. What's going to be before we close, what's going to be the theme of that conversation?
We have a couple different things that we're going through. I'm working on a panel with a couple other talented ladies that we're really looking at how the workforce has changed, the work from home versus in the office, the hybrid people. Also looking into what COVID has done for our industry as a whole. What are we looking at claim trends? What are we looking at COVID long haulers? What type of ADA accommodations would we need to consider for them if there are permanent disabilities that don't go away? So these are all things that we're going to discuss at the Wisconsin Work Comp Forum. I believe I'm speaking on the 6th, so next Wednesday. And we're really excited to kind of have that opportunity to have that discussion with a group of great professionals. Excellent. Yeah. So October 6th, if you're available, go and check that out. And if folks want to reach out to you otherwise, what's the best way to do that? LinkedIn is great. You can find me under Theresa Clarke Schmidt, or you can send me an email. I'm always available. Theresa, Theresa.Clarke, CLARKE @aah.org. Excellent. Well, Theresa, thank you so much for your time.
love the conversation, love hearing your journey and where you're going next within that story. So thank you and good luck with everything.
Thanks so much, Mark. It's been a pleasure.
You've been listening to Beyond the Claim, a podcast for risk and claims leaders. To ensure you never miss an episode, please subscribe to the show in your favorite podcast player. If you use Apple Podcasts, we'd love for you to give us a quick rating for the show. Just tap the number of stars that you think the podcast deserves. Until next time, stay curious and keep innovating.